Today, we're talking about how drug use affects wound healing, not just the medical facts, but the human story. By the end of this video, you'll understand what these wounds often look like, why healing gets harder, and what you can actually do, even without fancy tools or titles. There's a common belief that people who use drugs just don't care. But what if we're missing the bigger picture? What if these wounds aren't just about bad habits, but about missed chances, broken systems, and deep survival? Stick around because this story isn't what you think. For those who don't know me, my name is Dr. Voltaire. I'm a wound care physician and a family medicine doc. I'm not an addiction specialist, but during my residency and outpatient work, I've cared for patients who use drugs and live with the scars that followed. I've learned a lot, not just from textbooks, but from listening. And that's what this video is about, listening deeper. If you're a healthcare provider, a family member, or just someone who wants to help, this is for you. You don't need to be perfect. You just need understanding, patience, and a few practical tools. Here's what we'll walk through: what wounds from drug use really look like, why they show up in certain places, what gets in the way of healing, and what you can do when someone avoids care. Also, the small, repeatable actions that actually help without judgment. And near the end, I'll share a quiet shift in my language that made wound care feel safer for my patients and easier for me. Let's get started. So what do wounds from drug use actually look like? Some are obvious, some are not. You might see abscesses, which are swollen red-hot lumps that feel firm or squishy. Ulcers, so open areas with jagged or crusty edges. You may also see track marks, dark lines or scars along the veins. Or cellulitis, skin that's warm, red, and painful, signs of an infection. But sometimes it's just a slow to heal sore, a small spot that keeps opening, or a patch of skin that's thin, shiny, or bruised looking with no trauma at all. Drug-related wounds aren't always obvious. Let's break it down. It's not just the drug, it's the how, the where, and the what else. Injecting into the skin breaks the natural barrier. Also, many street drugs are cut with other chemicals that are acidic, toxic, and irritating, complicating the wound. When veins collapse, people inject into small tissue or muscle. Those areas aren't designed for it. And a sterile technique is rarely an option on the street or in a shelter. Think about it. A person injects into the same spot over and over. The tissue eventually then breaks down. The blood supply gets weaker, and the healing stalls before it even gets started. We're not talking about blame. We're talking about biology and repeated injury. Now let's talk about the barriers. This is where compassion meets complexity. Circulation is often poor, especially in the legs. Smoking, cold exposure, tight footwear, and repeated trauma all lower blood flow. And without oxygen-rich blood, tissue dies and wounds linger. Nutrition is usually limited. Protein helps build new tissue. But if someone's eating one meal a day or only carbs, the wound can't rebuild what's lost. Hygiene can be hard as well. No clean water, no shower, no place to store gauze. Even if someone wants to clean the wound, they may not have the supplies or the privacy. Trust is thin. Many people have been hurt or dismissed by the healthcare system. They've heard, "Why don't you just stop?" And when they feel judged, they vanish. Which brings us to the emotional cycle of shame, avoidance, infection, more shame, more avoidance. Sounds familiar? Here's where to start caring for these wounds. Gentle cleaning with sterile water, saline, or hypochlorous acid like Vosh. No scrubbing, no peroxide, just rinse gently and pat dry. Look for red flags, so ask or observe for fever, sudden swelling, new smell or drainage, and increased redness or pain. These are signs of an infection, and they may need medical care. Also keep it simple. Use non-stick dressings or gauze if you have them. The goal is to keep the wound protected. Also build small trust. Start with comfort. So ask, "Want me to help you with cleaning that? Would you feel okay if we covered it?" Let the person lead, don't force. And if they say no, respect that. You've opened a door, at least. If you're listening to this and thinking, "This feels close to home," you're not alone. Whether you're a caregiver, a clinician, or a friend, you don't have to fix everything. You just have to start where you are, with a clean rinse, a gentle word, and the choice to see the person behind the wound. Remember how we started talking about how drug use changes healing? It does, but not because people don't care, because healing isn't just medical. It's social, emotional, and structural. Wounds from drug use are complex, but they're not hopeless. Every small act, every gauze pad, every honest conversation, every time we show up without judgment, that's medicine too. And that's how we help people heal. Thanks for watching. If this video was helpful, check out my next one on animal bite wounds, dog bites, cat bites, and how they fool even experienced clinicians. Stay informed and heal well.